Everyone, my name is Faik. We are Beloit Mixed Media, and our club has a unique objective to portray different stories and experiences at Beloit.
Hello, I'm Tanzir, and we have our two guests, Professor Disha and Professor Kevin.
Hi, Professor Dish and Kevin. How are you doing today?
I'm doing pretty good.
I'm doing pretty good as well.
Can you please introduce yourself?
It would be better.
Ladies first.
Okay, thank you. So I'm Disha Shende. I work as a faculty. I'm assistant professor in the Department of Economics. I joined Beloit College in fall 2020. I joined as a visiting assistant professor originally, and then I was promoted to tenure track assistant professor. So that's where I am right now. Also, I teach courses in not just economics, but also in data science and data analytics department. So currently I'm teaching microeconomics, principles of economics and business analytics in this semester. But I'm also planning to teach a new course in spring, which is economics of race and inequality.
That's really good.
Yeah.
What about you, Kevin?
So, hi everyone. My name is Kevin Smith. I am a new assistant professor in the economics department at Beloit College. I recently just graduated, so I started in August. My courses are mainly like quant heavy, so I teach quantitative methods and I teach econometrics. And this semester, I'm also teaching principles. Next semester, I'll also teach health economics, which I can't wait to teach because healthcare is like my specialization. And then I hope I get to teach some courses in finance because I did a lot of work in finance in my grad school. So I'd love to teach a course in like corporate finance. That's one of the areas that I'm really interested in.
That's great.
Okay, so let's, before moving forward, I want to know, how is your day going in a week? And how is the weather? Did you find it any interesting?
So I have a story.
Yeah.
Yes,
So,
please.
yes.
Okay.
So this weekend, I was actually in Fort Lauderdale, Florida, for a conference, and so I left out of O'Hare Friday night, and when I got to Florida, it was 80 degrees and very windy, and then Saturday it was a nice 72, windy, beautiful beach views, gorgeous, and then I just got back this morning at 2 a.m. to O'Hare at around 23 degrees. And so, yeah, it took me a while to acclimatize back to the Midwest after a weekend in Florida.
It's been like 2 winters for me here, but I'm still not used to this cold weather. I don't like it. I was not expecting to move to Beloit. If you had asked me this question 3 years ago, I probably would have said I want to move to California. But here I am with you guys, but loving it here.
But the first snow must be really enjoyable, right?
Yes, but my first snow was in actually Cincinnati. I was in Midwest for a year. That was during my master's program. So yeah, that was a lot of fun.
Oh,
But then I didn't have to experience that kind of snow again for about 5 years. That's when I was doing my PhD, and I was in New Mexico that time.
For me as well, it's very hard to go off in the winter. I don't know why, I don't know how I can survive this winter. Basically, I would tell you, my own story, what is going on. I have my roommate. He's also from India. So I'm feeling, very cold. I easily feel very cold and I get easily sick. So what he do, I guess you know Kevin him, but I'm not going to say the name.
Okay.
No, we need to know the name.
No, it's fine. Okay.
No, I want to know. No, I'm just kidding.
I will tell you his alternate name, Rakesh.
Okay. Yeah, I know who.
Yeah, I guess you know him. Yeah. So in between, in middle night, he will open all the windows, and it will be so chilly in room, and I have to take my another blanket and cover up myself, so that I can be bit warmer. Because I don't know how he's feeling so hot, so that he's opening all the windows and all.
Where is he from?
He's from India.
No, where in India?
Mumbai.
Okay.
So I don't know how he's feeling so hot. So that's that's very hard for me. So, but yeah, still it's going pretty good for me as well. I have seen snow in India, specifically I went to Kashmir and then a few lot of places.
Yeah.
Yeah,
so
but,
lucky. It's my first time seeing snow.
Oh, really? Okay.
Yeah.
So I grew up in Jamaica, so we didn't have any snow
Okay.
forever.
Oh.
But I did my grad school in Pennsylvania, and so I got a chance to for 6 years experience winter and experience snow and stuff. What's funny is that for 5 of those 6 years I didn't have a car, and so the last year I was like, I'm gonna get a car. Worst snowstorm we ever got. Like I had to dig out that car for like 3 days.
Oh my god.
So yeah.
Talking about car, like you don't know, like sitting, like my friend sitting backside as well. They also know the feeling of not having a car. I can understand.
Yeah, it's hard.
hard.
I have been in your place. So I know your pain. I can
mean,
feel
every
it.
master student has been there.
Yeah, so
Yeah.
it's like so hard, but
Yeah.
still it's going pretty fun. Yeah.
So this was the first snowfall for you.
Pretty much yes.
And so what did you do? How did you enjoy?
I don't know.
I can tell about these stories.
Yeah, I want to know how, because my first snowfall was amazing. I just took so many pictures.
Really? Oh, wow.
I mean, I didn't
It's
take any
amazing.
pictures, but I was just like running in the snow, making sure I fall down.
Yeah, making sure he fall down. He actually fell down as well.
Really? In the snow?
Yeah, it's fun.
mean, you
I've never walked on snow,
okay.
so
Okay.
It's like the sliding. It was sliding.
It was,
And-
I mean, you usually slip when it's icy. It was not that icy, right? I didn't think it got that
it
icy.
didn't get,
yeah, that's why I was forcing myself to slip down.
Okay,
That's what
that's
he
why.
was
That
doing.
makes sense. Okay.
Yeah, it was actually fun.
So
Okay.
what do you say? Let's move to the first segment.
Yeah. Okay. So before starting this, we are going to divide each of the segments into like few parts, and I'm going to give a small overview about what we are going to talk about in whole of the segments. So first of all, we are going to talk about the health economics, which is a fun part, I guess. So
Especially for Kevin.
I guess so. I don't know.
I guess, yeah. And then we are also going to talk about little bit about the careers and how data analytics also involved in health and economics. And
That's really interesting.
yeah, is it? So, and then we are also going to talk about their experience as being an economist and how they had shifted their pathways to an economist. Yeah, and then we also have like few like good segment. One of the good segment, I guess, because Professor Disha has been shifted from like engineering to economist. So I don't know what came up to her mind, and she shifted.
Oh my God.
Everyone wants to hear about that.
Yeah, I get that
What
will
what
be.
major are you planning to choose?
I'm planning to choose in.
I
math
hope I
and
can change your mind if you're not planning to major in
He's
econ
a really
already.
stereotypical Asian, so he's gonna do computer science.
No,
No.
I will try to change his mind now.
You could triple major. A lot of students are triple majoring. So
Yeah, that's right.
Yeah, but I like math, physics more. So sorry.
And econ.
Oh.
And econ.
Econ too. Yeah, math, physics,
Let's
econ.
see.
Yeah.
Let's see. But yeah.
Yeah.
So-
So
Okay.
the first question will be, what do you think about the healthcare industry in the U.S.?
Okay. So I can give a little bit of background information about the U.S. healthcare system. So the contemporary American healthcare system really started after World War II. So a lot of companies needed a way to kind of get more workers, right, to come work at their factories, work in different industries. So they started to offer healthcare as like a benefit, right, for these workers to attract workers, right? So that's how the kind of modern day healthcare system grew out, where the vast majority of Americans get their healthcare from their employer, right? What happened over time is that issues started to come up with older Americans, right? So what happens is that how insurance works is that you need to have a pretty diverse risk pool, because you can't have people who are all very likely to get sick. And the older you get, the probability that you'll need medical care goes up substantially. So what ends up happening is a lot of older Americans couldn't get health care once they hit about 60, right? And so what happened is the federal government created what's referred to as Medicare, which is basically a health insurance program that if you're over the age of 65, you will get health care, guaranteed, right? And then they expanded that by creating what's called Medicaid. And so this is typical, like how government works. They make two programs that sound very similar but are very different. So Medicaid is more aimed at poorer folk. And so if again, a lot of times people go to the hospital and they will consume medical care, but then they can't pay, right? Okay. And so the hospital has to kind of absorb that cost. Mm-hmm. So what they did is they created this system for poor people, Medicaid, where basically as long as you're poor enough to qualify, the government will basically pay for your health care. So America has kind of developed what's referred to as a multi-payer system, where whenever you go consume healthcare, who pays for it, it can be very different. It could be your employer health insurance, it could be the government, it could be a mixture of both, right? And then there are also other levels of complexity within the system, like which hospitals you go to, and then also whether or not you want to keep a primary care doctor or you want a specialist, and it just the complexity grows exponentially from there.
Yeah, that makes sense. So this is where the inefficiency is in the US.
Right. So a lot of other countries, I know we're going to talk more about like global perspective,
Yeah.
but a lot other countries have what's called a single payer system. So where there's one payer, and typically that's the government, or if they have an employer-based system, right? So Denmark has an employer-based system where you get your healthcare from your employer, but it's there's a lot of controls, right? So for example, all jobs are required to give you health insurance, whether it's from McDonald's to being like a hedge fund, right?
Yeah.
In like Denmark, in the US that's not the case. There is a small employer mandate where if you have like over 30 full-time employees, you have to give them healthcare, right? But a lot of companies will kind of get around that by having people be part-time instead of full-time. And so we still have like millions of people who are employed but don't have healthcare, right? And so America has this kind of multi-payer system, while much of, especially the developed world, has what's called a single-payer system.
Okay. So talking about the healthcare industry, I think Disha has a really interesting story about the
Okay.
experience with any healthcare.
Okay, are you referring to any specific one?
Yeah, I guess I heard some story about her.
What did you hear?
Yeah.
I don't know. I might have many
Oh,
such
no.
stories. Which one are you talking about?
Yeah, yesterday
Oh,
he
yeah.
was
Okay,
telling
so are
about
you
it.
talking about my recent class, principles class? Did Ishan share a story with you?
Yeah, I guess. Yeah, oh, yeah.
That's where I heard it from.
yeah. Ishan shared the interesting part.
Okay,
Yeah.
okay. So I was
Okay.
just telling how complicated healthcare system in the US is, and how that motivated me to go back to India and get my braces treatment done.
Oh.
I mean, it's, like obviously I have my health insurance, and I have like a good. We have different metals in health insurance. I have a good one, but it's still very difficult to navigate through it. You have to get an appointment. Getting an appointment is so difficult.
Yeah.
If you have to, you have to wait for months sometimes to see them the first time, to get the first appointment. So for me, it was just easier to go back to India and just get my treatment done there. And even like I traveled there multiple times because it was braces, and you have to see the dentist, like you have to see them multiple times. It was just easier. So even though, and yeah, one more thing that even after insurance, it would have costed me more to get my treatment done here. And I got it done
Flying
for
back to India.
Yeah.
no, I'm just talking about the health,
Okay.
the medical cost of it.
But
So
But I can actually give you an example where in some border towns, like so you did your PhD in New Mexico, right? So some insurance companies will actually pay you to fly to Mexico and do
Yeah.
healthcare there,
Oh.
and then come back,
And
and
it's
that's
just
cheaper
Yeah.
than doing it in
yeah,
the US.
that's what medical tourism is, right?
Yeah, right.
A lot of
Exactly,
people
yes.
go to other countries to save cost of like healthcare. Yeah.
So I am imagining like like going back to India cost like near about $1,000, I guess. So, yeah. So you were ready to go back to India and like gave like $1,000 of the flight.
Yeah,
and-
because it was costing me 4,000 here, and it costed me only 500 for the treatment. 500 for the treatment. Compare that to 4,000 after insurance, and also I get to see my family. So why not?
Yeah,
Right.
that's fun. Like that sound.
So I don't really consider that flying cost as a cost in my equation. Yeah.
Right. Exactly.
It's
Yeah.
like you are going back to your family.
Yeah.
And again, to add to Disha's point, there's also a lot of waiting, because I actually was trying to get an appointment, and I actually have I first like scheduled it from September, and I'm going to have the appointment this week on Friday, so months later. So a lot of times it's very difficult to kind of get the service that you need unless you have like top tier insurance, or unless you're willing to pay out of pocket.
That's that sounds so dramatic as well. I don't know why. That's like it's hard for me as well. Like we got the plan of insurance as well.
Yeah.
As an international
I
student.
think it's 80-20 split.
Yeah, but still, like it's very hard to navigate through all the process because it's very complicated, I guess. For me as well, like yeah, you have to know this, you have to know this, you have to know this, and everything you have to know to like get through the final point. So,
Yeah.
and it's very hard actually.
And that's what I was referring to, like think about the average person, average US citizen.
Right.
How much information would they have to like collect in order to just go and see a physician?
Yeah.
It shouldn't be that hard. So yes, there are lots of issues with the healthcare system in the US.
And so one of the sad things about the complexity is that the U.S. does not have a lot of preventative care. So one of the reasons why so one thing about the U.S. health system is that America compared to other like what we call like developed countries, or you could look at like countries what's called like the OECD countries, right? The Americans pay the most for healthcare, but in terms of outcomes like life expectancy, infant mortality, it doesn't get the best outcomes, right?
Yeah.
And there are multiple reasons for this, but one of the reasons is that there's very little focus on preventative care. Because what happens is that in the U.S., and so many people are scared to go to the doctor, what happens if one day you're at work and you had a pain in your side, you're like, I don't want to really deal with it. I can't take time off. I'll just ignore it. And then over time, the pain gets worse and worse and worse and worse and worse. And then eventually you go to the doctor when you can't like walk anymore, and they have to do a surgery if you had like appendicitis, right? Versus if when the pain first came up, you went to the doctor, they could have prescribed you like a simple antibiotic. So the antibiotic is going to cost like $2-3. The surgery to fix the appendicitis is going to cost thousands of dollars.
Yeah, that's a big problem.
And so that is one of the huge issues that devils the healthcare system is that there, it's just there's very little push for prevention. And I mean, I can even give another example that I experienced relatively recently, where I went to go refill some medicine, and I met with the physician just to get it refilled because I moved from Pennsylvania to Wisconsin recently, and just the meet and spent like about half an hour with him cost me $230. And I was like, what? After insurance. After insurance.
Oh,
And so I was like, what? And so I called them because this is my area of expertise, and they were like, oh yeah, because because it's the first time so they had a fee for the first time you met this physician, then they had a fee for if you spent 15 minutes versus half an hour, and then they had a fee for him diagnosing you, and then so they so they really so that's those kind of costs are what push people away from actually going and using healthcare in a preventative way, and that leads to greater costs that we all face.
Yeah, I mean, Kevin is the person who knows about healthcare. What about some people like us? We don't know all of the details. They can easily overcharge us just to safeguard themselves.
Exactly, and that's why I usually my advice is that make sure that if they give you any kind of check or anything, so a lot of healthcare companies will send you what's called an explanation of benefits.
Mm-hmm.
Make sure that you ask them to please list exactly what charges they give you, and then especially with the plans I think Beloit offers, make sure you say that you want to only see an in-network physician. This is very important because a lot of these health care plans work within a specific hospital network and within specific doctors. So you may go to a hospital that's within network, but they may have doctors who may see you who are out of your network. So if you are seen by a doctor who is in your network, your health insurance will at least pay part of it. Mm-hmm. But if you're seen by a physician or a doctor who's outside of your network, you have to bear the majority of that cost. So it's the whole system is incredibly complex to navigate, and to be honest, I don't see it simplifying anytime soon.
Yeah. In that case, we miss our home country now.
So
it's so easy to just walk into a clinic and
Exactly.
get your diagnosis done. You can literally just walk in anytime.
Yeah,
And the doctors are so good. They sometimes waive your fees.
Oh, that hasn't happened with me.
I guess that happens in Pakistan only.
Okay.
I guess so. Then it's good. Like talking about like simplicity of making an insurance or like different policies for different plans for a different people. So what do you think like would be the best way or the easiest way for making a plan for in a larger perspective for everyone in US or somewhere?
Are you talking about universal health coverage?
No, I'm just talking about in US, like what should be the best way to make an insurance policy or whatever to be like easily understandable for everyone.
That's such an incredibly hard question, I think. To solve the healthcare system in the US, I think previous administration was trying to come up with a plan. They never came up with one. And we tried to make it easier. We had Patient Protection and Affordable Care Act passed by Obama.
So this is the question Professor Kevin gave us in the test.
Oh,
How to
really?
improve the healthcare in the
Oh
US.
yeah, I did give a question on this. Yes.
What class was it,
This
though?
is a clear
No,
evidence that
principles.
this was a difficult test.
Yes. Yeah. Actually, so that question was more of me. So I was more curious about what answers you would have come up with.
Yeah.
But the issue with I'm going to see if I can try to answer your question is that the U.S. system, as I said, kind of developed by accident because again it came out of like World War II trying to attract workers. If Americans could start the system over from scratch, I think the best system would kind of be a single payer system in which the government basically pays for, so you pay through taxes, everyone pays, and then the government provides the payment for the healthcare. Because one of the issues with the American system is that it has extremely high administrative costs. Yeah. Because it's a multi-payer system, right? So people could have multiple different health insurance companies, right? You could have private insurance, but also public insurance. And there's like all of these different complexities. So you have to build a huge administrative apparatus to kind of run it. And that increases costs. While in other countries, there's just one payer, right? So there's the government. So that kind of administrative burden is removed. But you can't really do that. And so that's why actually other health economies have gone to countries like Taiwan, for example. Taiwan has a great healthcare system because they basically were able to start from scratch, and they were able to build up their healthcare system learning some of the lessons of the American system, the Canadian system, the British system, right? And they were able to create, like, I think right now one of the best healthcare systems in the world. Something I mentioned in my principles class is that Taiwan system is so good. Like, elderly people, and this is actually a problem in Taiwan, will actually go to the hospital and just hang out. They'll just go they'll just go every day and just hang out and like talk to patients and like get medicine and do whatever they want to do because they're like, oh, it's fun. It's like it's free and I don't have to worry about it. So yeah.
Yeah.
That's it. So when we're talking about the healthcare, what do you think? Like, can data analytics and AI help it improve?
I think we're already using AI and data analytics a lot. Like big data is being used in healthcare industry to improve health outcomes of people.
So does it like managing the data of the patients or something like that?
Yeah, it could be managing data of patients or even related to insurance. It has application in every every field related to healthcare.
So this is where the CS and the econ thing merges up.
Yes.
And to move forward and let's see about actually we talked about the US health economics, like how would it work, like how it's working and what would be the best way to make it much more simpler, multi-payer, which Kevin said now, which is our US health economics is. We can make it in a one payer because a lot of countries having the same formula, like they are using a one payer economic system. That's how it's working. So let's move forward and talk about how health economics works in a larger perspective. What do you see in a global perspective? How does it work in different parts of the country?
So in different parts of the world, you mean?
Yeah.
Okay, so as I said, the U.S. system is unique because it started kind of by accident. But again, it's basically about where your starting point is, because after World War II, a lot of Europe was decimated, right? Yeah. So they had the ability to start from scratch. And so if you look at Europe, they're more likely to have a single payer model, right? So the government pays, or a universal health care model, where, for example, as I mentioned, Denmark, there's a lot of people have private health insurance, but it's built where every employer has to give you healthcare, right? And then there are also a lot of like price controls, so you can't charge so much for a certain medicine. Canada and the UK have very interesting systems, where in the UK it is not just a simple single payer system where the government pays, but the government actually owns hospitals and will actually hire doctors, and actually owns the schools that trains doctors and nurses. So that system is completely integrated, right? So it's called NHS. And so it is one of the more interesting systems, but it does require a lot more work when you own the hospitals and you own the schools to train medical staff and stuff like that, versus Canada's system, where it's still single payer, but they allow a lot more ability to get private health insurance, and so that has its pluses and its minuses, because if you have the money, you could easily get healthcare and get things done. But if you opt for the public system, right, you could be on like a wait list for a very long time. So it's,
I was just going to bring up that point that Canada, people usually complain about long queues. So I don't know. There are downsides to both systems, I think. I mean, even with the single payer system, if you want to bring that in the US, there's going to be a lot of opposition to that. And also we have to think about the R&D, like, is it going to discourage R&D because it's now controlled by the government? So, you know, like if it's controlled by the government, then the prices will be, there will be price control potential. So is it going to discourage R&D? So we have to, and in the US especially, I think that I don't see that happening, because it's so much, you know, innovation driven economy. So there's its benefits and costs.
right. And the thing is, again, one of the things I mentioned again is the massive like administrative structure that's been created in the US to handle the multi-payer system. But we call those administrative costs, but those are actually people's jobs, right? And so even if you want to streamline the system, you have to go to tens of thousands of people and tell them, oh, your jobs are no longer necessary.
Yeah.
And so that's very difficult.
So like talking about this, like one time I read some article somewhere, like I don't remember. Yeah, it's just like how actually the insurance company governed by like the different part of the, like how the insurance companies work with the hospitals and different government policies as well, and how they'll actually collaborate and make a profit out of them. So what do you think about the structures, like how they are? Like it's very fancy structure, but it's like very complicated in it. But it's very like if you go in deep, you can easily understand what they are trying to do, to a normal people.
Sorry, I don't really understand the question. Can you repeat?
So I think what this question is about is there some kind of like collusion between the health insurance company and the hospitals and then with the government?
How they are actually making a money.
Right. So in reality, it's okay. So people have different opinions about this, but they're actually at each other's throats. So with the health insurers and the hospital systems are actually fighting each other. Because the point with the health insurance system, so they're what we call payers, right? Because you get health insurance, and the health insurance will pay for your health care when you use it, right? And then the hospital systems are what called providers, because they are the ones that are providing health care for you. But what happens is that the providers are always trying to seek as much money from the payers, and the payers are trying to pay as little bit of money to the providers. So it's actually a massive fight between both of them, trying to not pay too much to the other. And so what should happen is that the government should step in and set rules and set regulations. But the issue with the US is that both the hospital system and the insurance companies have massive lobbying power. And so they're able to lobby to make sure the rules, if they're changed, benefit their side, not the other side. So the collusion really isn't happening that way. In fact, I think there's actually a law that you can't be a health insurance company and own a hospital network or something like that. It's like if you're a movie studio, you can't own a chain of theaters, because that would give you too much market power, right? You could come in and you could say, all the movies from my studio and my theaters are going to be cheaper than all the other movies, right? So that would kind of give the other movies a disadvantage. So I believe there's a regulation where the insurance companies and the hospital systems that actually can't be like owned by the same entity. But yeah, so they're more likely to be at odds than to try to collaborate.
Yeah. So I think that pretty much sums up the healthcare industry and all the global health issues. So we can move to the second segment of it. Second segment of the podcast.
Yeah.
It's going to be about economics and all of your journeys. So Disha, you have a very interesting journey.
I'm
from
very
CS
curious
to
about Disha's
economics.
journey.
Yeah.
And pretty much every international student sitting here wants to listen to your journey.
Okay.
Me as
How
well.
was
I
your
am so
shift?
eager to know.
Oh, wow. Okay.
All the cameras on you.
Okay. Yeah. So.
Ishan, on her.
Hey. So yeah, I did engineering and computer science. You are planning to do. So yeah, I mean, I think that's the convention. Like like a lot of families.
Yeah.
That's the convention in let's be honest, in South Asia. So I think it's same in Pakistan, right? So you are expected to become either an engineer or a doctor or a lawyer. So one of these three. And I was interested. I knew for sure I was not going to go for a medical school. So what's left? I didn't want to be a lawyer. So what's left? Engineering. In that, I had particular interest in computers. Like I like playing video games and playing with just hardware of the computer, like with my CPU, like.
That's so much me.
Yeah, so I was always interested in that, and then I was like, okay, let's do computer science engineering, because that was the option that I had, like among many other options. I didn't want to do electrical, mechanical. So yeah, I did my computer science. It was a lot of fun, actually. I loved the programming aspect of it. I remember my C class particularly, where I just loved making programs where you had to like print stars in like one star and two stars and like the different patterns exactly. And I actually enjoyed learning like different courses in computer science. And then during my third year of engineering, we have companies. They come to your campus and they like interview you. So we had like campus placements, and I was placed in Cognizant Technology Solutions. I don't know if you have heard of that company.
I know it.
So before graduating, I had a job, which was a big deal back then. And then I worked with Cognizant for about 3 years. But the type of job that I had, I wasn't very happy with it. Meaning I was looking for a job in software development back then, but I ended up in software testing somehow. So I liked it, but it wasn't what I was looking for. And then I was like, okay, I changed my job, but even there, your previous experience counts. So it was a better role, but kind of similar. So I was like, I want to do something else. This is not for me. And in my engineering, I always had this wish to go abroad and explore, like just go for higher education. I just didn't know which field. And that's when I was like doing my research. I thought, okay, let's figure out other areas. Why not? Why just engineering? Why just computer science? So I was doing my research and economics. Yeah, just when I was reading more about this area, I was like, okay, this feels like something I would enjoy. And it has so many applications. I was just discussing with Kevin this afternoon that you can enter pretty much in any field after econ. So this is giving you knowledge in almost every field. And like economics, you can choose a concentration of health economics, for example, or development economics, or you can choose a financial economics as your concentration. So you can work in like many different areas once you have your econ degree.
Yeah.
And it kind of makes you aware how basically the world operates, so that was the thing that really drove me to economics. And then I decided to do like a master's degree because I had no background in econ. I had never taken an econ class in my undergrad, never in my high school. I don't know if you have ever taken,
No,
but
it's my
yeah,
first time
during
economics.
that time when I was in school, we didn't have any class. So I did my master's, and it was a lot of fun. I thought doing a PhD would be a better idea, although I gave it a second thought after getting into my program. I think everybody,
Everyone
it was
does.
such a big commitment, like
Yeah,
going for a PhD. So, but no, I did have a lot of fun, just learning something new, like learning about. So my research was in development and public with a focus on health. I don't call myself as a health economist. Like I think Kevin is a health economist. I'm not, but my focus was on health. So yeah, I had a lot of fun, and here I am after that with you guys doing
That's
this
a great
podcast.
journey.
It is.
That's interesting as well. Like it's very common in India, to doing like engineering and like doctor or to be a lawyer. Like for every household, you have to be like good with math.
Yeah.
If you are good with math, go for engineering. If you are good with like something else, then go for doctor.
Yeah, no, there was so my family, they weren't very happy with my decision because they were like, why are you leaving your job? You already have a job. Why are you, like, are you crazy? Why would you go
That's
for
so inspiring.
masters? And then they weren't very supportive initially, but now they are very happy because the kind of lifestyle that professors have, it's very nice. I mean, if you should think about going for PhD.
I mean, I think they're at the starting point, so I don't think they're
Right,
professors.
obviously.
right. But I
But
mean,
I'm just saying.
it is okay. So I guess I can talk a little bit about my journey, but I'm
Yeah.
curious about something, Disha.
Yes.
So what convinced you to do the master's program? So you said you did your research and you said you liked econ, but like what was the thing that pushed you over?
That's a
So
good
I
question.
knew I didn't want to, I knew that I didn't want to do engineering masters. I didn't want to get into that because I wanted to explore other areas. That was the really, motive. But econ, so I had other, I was thinking of even management. But econ struck because I just felt that I could, if I don't enjoy it, I can still go in like a finance, or even data analytics field. So yeah, and it wouldn't hurt to just gain knowledge in econ. Does that make sense? I don't know if that makes sense.
I mean, that's
Like,
what
I
liberal
got-
arts is for, right?
Yeah, I got a very interesting question. I don't know.
Yes,
it's just
go
like
for it.
you could have done MBA because
Yes,
lot
which
of
lot
Indian,
of people do,
Yeah.
and they never get asked that question. Like, why did you do MBA? They never get asked that question. I get this question all the time. Why did you go for econ? Because that's not the norm. I know.
Yeah. So
I don't know. Like MBA, I don't know. I didn't want to end up again in corporate world. I think probably that's why. I guess.
that makes sense actually. Yeah, it's quite I don't know, but I heard from few of my friends who are like working on somewhere, like in last summer they worked in, so they are now planning to do join academia. I don't know why, like in 1 year, because they have worked like summer in some of the companies, so they are thinking of doing an academia instead of going for a corporate job.
yeah,
So
yeah.
it's
yeah.
like so hectic for them, I guess. Yeah, I don't know. Just they were doing an internship. Yeah, they just switched their mind like internship. I don't-
So it was so hectic in internship that
Yeah.
they want to come back to academia.
Yeah, it just I guess they like they like similar to me. Like I like to do much of like solving something instead of doing like somebody on like head do something. So you have to like be on a time. You have to do this and this.
Yeah.
That's kind of problem they have.
Yeah.
Well, the thing is, if you do like to be your own boss and have that kind of freedom, that's why a PhD may be good. Because again, you could go into academia, but a lot of especially in like hedge funds or a lot of the companies in Silicon Valley, a lot of the tech companies, like they want to hire people who they know can think through issues and think through problem solving. And so one of the benefits of the PhD, there are a lot of costs, but one of the benefits is you can show people that you can do your own independent research, and that you are good at like solving problems, right? And so that's a really big thing that a lot of companies look for, and a lot of the PhDs in some of these companies get a lot more leeway to kind of do their own projects and go their own way.
Yeah.
Yeah, basically you're your own boss. That's
Right.
true. It gives
So
you a lot
what
of
was your
autonomy.
journey in the econ?
So okay, as I said, I tell two stories here. I tell one that's optimistic and hopeful, and I tell one that's kind of more realistic, and the truth is somewhere in between. So I'll tell the hopeful one first. So I've always loved reading. So I've always loved books. I've always loved to just like read a great book and kind of get into a story. And so I knew when I was in high school. So how Jamaica works, we work on the British system. So our high school works lasts 7 years. So we have 1 to 5, and then we sit like at exam in year 5, and then you can spend an extra 2 years in high school called sixth form. And so in sixth form, you kind of the situation kind of changes where you have to wear a tie to school every day, and you have to be more formal and stuff like that. And so when I was looking at my course list, I knew I wanted to do English literature because I loved reading and I loved books. But I need to find a course that wouldn't clash with it. And so I ended up picking economics. And so I was like, I don't know anything about economics, but okay, let me just try it. And so I did it, and it was just, what I liked about economics is that it gives you tools to answer questions. One of the things I've never liked about stuff like philosophy and stuff like that is that they ask a lot of interesting questions, but they don't give you the tools to try to answer them. Or in some cases, they don't think answers even exist.
Yeah.
Which I find frustrating. And so what I liked about economics from the very beginning is that it gave you a lot of tools, and it gave you a lot of answers to why the world is the way it is. And so that really attracted me to economics. And so after high school, I went to my college. So Jamaica only has like 2 colleges. So I went to the better of the 2. So and then my plan was to like double major in economics and English literature. And so I took econ classes, took literature classes. I realized very quickly that my writing skills were very good for economics, horrible for English literature. Awful, terrible. So I actually failed a course in my second semester of undergrad. And
I refuse to believe that.
No, I did. I failed it. I was stunned. I was like, wow, okay, that's not. So this is not going to happen.
Thank you for sharing that.
Yeah, so it I mean, that's what happened. And so so it really like made me want to kind of double down on economics. And then and I really liked it, and I took a bunch of like different courses in like public finance. I took courses in like international trade. I looked at like the breadth of the whole discipline and so I really liked it. And then I continued and did my master's at my undergraduate institution. And then I took a gap year where I went to like China. But then after that I did my PhD in Pennsylvania. And so I just went all the way up, and after that now I'm here.
That's really interesting.
It's so like you were like, I want to ask one interesting question. I don't know, just it struck my mind. Like you just said you went to China. So like, why did you went to China?
No, so I've always been interested in languages. So growing up in Jamaica, they really try to get students to be interested in like Spanish and French, but I just didn't care. I really couldn't get into it. But I was always into like anime and into a lot of like Japanese stuff. So I did Japanese in undergrad, and I really I loved it. And then in masters, I'd done all the Japanese courses, and I was like, well, what else I'm gonna do? And then I saw there were some Chinese courses. I was like, all right, I'll do Chinese then. And so I did Chinese, really loved it. And so there was actually a program that actually allowed people to like leave. It's not just Jamaica, but it's all over the world, to go to China for a year and like study Chinese within China. So I kind of knew I wanted to do my PhD, but I wanted a break, so I went and I applied for the scholarship and I got it, and I went to China for a year. I lived in this northeastern city. It's the capital of Shanxi province. It's called Taiyuan, and so I lived there for 1 year. And it was quite the adventure. I mean, before I landed in China, I had studied like I said, I studied Japanese for 3 years, studied Chinese for like 2.5 years. I was like, okay, I think I'll be okay. I landed in China and I realized, oh, I don't know anything. I know literally nothing. I thought, oh yeah, I can get around. No, I could not get around at all.
Yes.
So yeah.
Our Chinese friends shared the story. Like, if you want to navigate to one place, you can't even ask someone. So they would just point you towards that.
Oh, I had the same issue. I could not. Like, I went shopping in China. I was in China for like 2 days, not very long. But I went shopping and I could not even shop. It was so sad because I liked the stuff and I was just using like sign language and they could not understand. It was frustrating, but I understand. I mean, they don't have to know English.
One thing that I didn't realize is that when you're in a country you don't speak the language, so much communication can be done non-verbally. I didn't like especially when I just went there. I could go to like a menu and I could like just point at stuff, and then you could like do stuff where you like can like mimic action.
You have to be an actor.
Yeah, you have to be an actor. But it really showed you how like communication is not just like words.
That's true. This
I mean,
year
it still can go wrong.
True. Yeah.
Yeah, that's right. I went Vietnam this past summer, and I was just using Google Translate the whole time, and it worked fine. It worked out fine. I didn't need any help from from person who knows English. Like I didn't need translator basically.
Oh, I see.
Yeah.
That's really interesting.
Yeah.
I mean, we didn't knew that the economics department at Beloit had so many diverse professors. One of them knows anime. One of them is from an engineering background.
Yeah, it's
So we
quite interesting.
yeah,
Actually.
it's quite interesting.
Okay.
And
But I just had remembered that you know Japanese, right? You can speak some Japanese.
I can speak some.
Can you say
But
something
it's
for?
no, I've it's been so many years. It's
Come
been
on.
so many
Especially
years.
not on podcast.
Not on podcast. No, it's so many years. It's so bad. And the thing is, it's so sad because a lot of my Chinese is also gone too. I mean, it's really the number one thing of language learning is use it or lose it. And
Yeah,
so if you
that's
don't,
right.
If you don't practice, if you don't read, if you're not into like the media, I had a friend who made sure he turned everything like into like Japanese. So he turned all his language on his computers, his phones, everything into Japanese.
We could relate to that friend.
yeah, that's what I was saying to my friend. Like he's from China. He's like struggling with his like little bit of language, so he's like trying to improve his English.
Right.
So that's what I told him. Like you should like change all your language from like your desktop, phone, and everywhere, like from to English, so that you can easily like you can see everywhere English instead of Chinese. So he was not doing it.
But it's hard though, and so that we all kind of know that that's what we should do, but it's hard, especially in like everyday life, to have to like struggle to figure out, oh, what does this mean again, and what is that, and so it is. I understand how like difficult it is, but I'll definitely say it was one of the most rewarding experiences, not just traveling to China, but the people that I met through studying languages. It was such a great experience.
Yeah.
So let's one more time. Like I told you before starting this, like we are going to talk about like how you were doing before in the COVID. Like you were teaching students, like how it shifted from now to then. Like now how it is going.
Oh, okay. Well, the thing is, how it's going. So during COVID, I was still a grad student, and so I did shift the kind of way I taught, in the sense that I was teaching a course in person two times a week, and then everything shut down, and I moved to teaching a course online. And so I'll be honest, that first semester was not great. I'm gonna not sugarcoat it. Like it was not like I just did not know what I was doing. I'm gonna be honest, and so
It's so us.
so it was definitely. I mean, my students. I mean, some of my students in the evaluation did complain, but I think all the students understood that everyone's kind of operating in the dark with this situation. But I definitely found that over time I got better at doing remote, and then before I came to Beloit, we were kind of moving. So we were back in person, but we also had like some kind of hybrid thing too, so we could teach students in a hybrid manner who had to isolate if they tested positive. So in terms of that, I definitely learned skills about how to teach synchronously and asynchronously. I do think that because of COVID and the COVID isolation, there is somewhat of what we call a learning loss, right? Because there was this huge thought by a lot of guys in Silicon Valley that, oh, why do you need all these professors teaching all these classes? We'll just get a guy from Harvard and he can teach 10,000 students, right?
Yeah.
But what COVID taught is that, no, actually you need a professor in a classroom teaching students. And because even though remote can work well for some students, right? And some students can really thrive in a remote environment, a lot of students need to be in a classroom with a professor or with a teacher to go through work, because that's how a lot of people learn. And so I think because of those two COVID years, I think there has been some significant like learning loss, and so that is something that will have to be addressed moving forward.
Yeah.
What about you? Sorry.
No, that's okay. So I was here. That was the year when I joined Beloit, and that was my first year. That's how I started teaching remote. So I didn't struggle particularly like when it came to teaching, because I was connecting my iPad as a as an external device, and I was writing everything just like how I would write on board, like on a chalkboard or a whiteboard in classroom. So yeah, in fact, for some students, I think it was easier to see what I was writing on my iPad. They could see it more clearly because it was right on their screen. I think one thing that I did not enjoy was when students did not turn on their cameras, because it felt like talking to a wall sometimes.
Yes.
And so we had like this mod structure. I don't know if you're aware of that. So the first 2 years, or I don't remember, was it for all? Actually, at least for first year of COVID, we had semesters divided in 2 mods. So each semester, spring will be divided in mod 1 spring and mod 2 spring, and then so would be the fall semester. So you will have class every single day, Like I was teaching microeconomics all 5 days. So you can imagine, on students, it was a lot of load, like learning all this content at once, when you have no knowledge of that topic prior. So it was it was very tough for students. I tried to be accommodative because I knew how hard it was for them. So I let them attend classes asynchronously, synchronously. I was recording all my lectures on Zoom, and I think it worked fine. But I don't think we were looking forward to go back to normal school year.
I mean, there's always a lag in between.
Yeah, right. You mean in the...
Yeah, in the voice. I mean.
Oh, yeah. Yeah, I don't think that was particularly the issue. But yeah, maybe. Yeah, that was the issue too for some students probably. But yeah. Then we went to hybrid mode, where you could choose to be in class, in the classroom, or you could also just attend via Zoom. So I gave all options to my students. You could sit in my classroom if you feel comfortable. Sit with the mask, obviously. You have to follow the college policy. Or you could attend sitting at your home. And I had a lot of international students as well.
So how many showed up?
Actually, there were quite a few who showed up. Yeah, there were quite a few. Because they enjoy learning content in person more, I think. I assume. But students who were obviously in other countries who could not travel to Beloit, they had no other option. And some students joined me at 2 a.m. or 3 a.m., those who were in India. So
I can imagine that, how hard it must be for them.
Yeah,
Like, it's
no.
like waking up in the middle night and you have to take class.
Yeah.
Like it's so
I
bad.
think it changed their whole schedule. They were sleeping during the day and staying
At least
awake
they don't
at
get
night.
jet lag when they come here.
That's true. Yeah. So yeah, I mean, it was a different experience. But yeah, I agree with Kevin. Like, it's much better in person, obviously, because you get to interact with the person face to face, and it's just a very different experience that way. And learning improves a lot too, because you can ask questions to your professor, or yeah. So yeah.
I think that pretty much wraps it up.
So that's what like at the end of the day, like at the end we are going to like little bit talk about it because we are going to cut it and then we can manage it. We are also going to talk about the careers in like economics. So you have to do that. So Ishan, yeah.
Yeah.
Now
Okay.
continue. Yeah, that's so. Now we are going to talk about careers in economics, like what are the careers involved in economics, like what are the segments which also like involves in economics, like why we should not choose MBA and we should choose economics. Yeah, and also like data science and data analytics. That's a very important part.
Okay. I mean, there are different paths that you can choose after studying economics. I have students who have gone for data analytics after doing, the economic after doing the econ major at Beloit. Yeah, you can go for grad school if you want to go for like a PhD. You can go for grad school and then you can join academia. But I mean, I don't know what else to say here.
So the good thing about econ is that it's very flexible, right? You can go in many different areas. But the advice that I give, and so I gave my cousin this. He's just finishing up at like NYU Abu Dhabi, and so I gave him that. Don't just do econ by itself. It really helps if you twin it with something else, like math or computer science or something like that.
Yeah.
But econ can take you down so many different paths, because economics is life. Like everything is economics, and so you could go, again, academic route if you like to teach and you want to do that. You could go the kind of data analysis route or data science route. You could go the kind of public policy route, right?
I did not mention that.
So
Yes,
if you
can
want to
go
work
public policy.
in like government and you want to make policies, right? You can do that. You can also go with like the NGO or the kind of like international route. Like, so I know people who've worked at like the United Nations and the IMF, right? And World Bank. And then you could also go into like work at in tech. So like startups. So like Amazon, well, before their layoffs recently, they hired like half of the graduating class of like Harvard PhD program in economics because they want to get as many like econ people as possible, because economists really understand how to build models that can actually show you that X causes Y. And so a lot of economic thought is thinking about how should we build models that are actually showing that this variable caused an effect on another variable. And so there are a lot of paths. There are a lot of paths in economics. To be honest, myself in undergrad and in my master's program, I would never have said what I just said, because I thought that the path was just like either unemployment or working at a bank or something. But definitely, I think one of the joys of like having done the PhD is that I got a chance to be exposed to so many different people and so many diverse people, and so I get to see, oh wait, you could take this path, you could take that path, you can do this, you can do that. So definitely, I think there are a lot of paths that you can go.
You can also join Federal Reserve if you're interested.
You do the Fed too.
You can go in pretty much every area. You can join go in finance field after econ. You become an investment banker. You can join a think tank and become a researcher.
What about MBA? Why you should not choose MBA instead of
I don't think you can. I mean, if you really are passionate about in about management as a field, I think you can go for MBA, but it's very expensive. You also have to consider that factor, And a lot of people, a lot of people who go for MBA, I think they're experienced, and it's mostly employer sponsored from top schools at least.
Exactly.
So it makes sense to go for MBA in that case, but you have to think about the returns to your education, right?
Yeah.
You always talk about that in econ.
Yeah. I mean, I also can consider an MBA unless it's and this is just maybe my uneducated opinion, but I think like unless it's one of the top say 20 or 30 MBA programs compared to econ, like econ will give you a lot of different skills and that can be approached in like many different areas. A lot of the MBA programs that I researched, because I was thinking about doing an MBA, seems to be tailor made for like C-suite, like you just wanting to go and be a manager in like some company, and so they didn't really focus on like giving you the kind of really in-depth analytical skills that
Yes, I agree with
that you get from economics. So
yeah, it's like knowing little bit about every field, like marketing, finance, HR. But if you want like in-depth knowledge, then probably that's not the best field.
Yeah. I think that's pretty much it. We should wrap it up.
Okay.
Thank you for your time. It was a wonderful talk.
Oh,
And
this
now
was
we know
fun.
how diverse our professors are. And
And he got to know different stories as well.
yeah, it was
Yeah.
interesting.
That's fun.
And it's much really informative from the international students.
right.
Yes.
So I guess that's it.
Okay. All right. Thanks for